Hi, this is Brooke Lounsbury, registered nurse and expert contributor at CaringVillage. Each week I answer your questions about caregiving and offer tips and solutions. Medical disclaimer: although I am a nurse by profession, I am not your nurse. All content and information shared is for informational purposes and educational purposes only. It does not constitute medical advice and does not establish any kind of patient-client relationship. Always consult a professional who is aware of all the facts and circumstances of your individual situation before making any changes or decisions about your health or well-being.
During a recent visit with my 8-year-old grandson, he told me all about the elderly gentleman who lives next door, who recently lost his wife and seems very lonely. I think this is a topic that doesn't get enough attention.
Loneliness among seniors is an increasingly recognized issue. It impacts mental health and overall well-being. There are many factors that contribute to senior loneliness, including living alone, losing a spouse, reduced mobility, and limited social interactions. Addressing this issue requires understanding its prevalence and consequences and coming up with some solutions. Recent studies indicate that loneliness is a common experience among the elderly. For instance, in the United States, about 1/3 of adults aged 50 to 80 report feeling isolated from others in early 2023, according to the University of Michigan's National Poll on Healthy Aging. In Canada, nearly 1 in 5 seniors aged 65 and older reported experiencing loneliness, with higher rates observed among women and individuals living in larger cities. Now, let's look at the health implications. There are a lot of health implications to loneliness. It's not just a social issue, but it's also a health one. Chronic loneliness can lead to serious health conditions, including depression, high blood pressure, a weakened immune system, cognitive decline, and even heart disease. Recognizing the signs of loneliness and addressing them can help mitigate these health risks. The signs of loneliness can really mirror what depression is in many ways, including withdrawal from social activities. Seniors who feel lonely may withdraw from previously enjoyed activities, social gatherings, or hobbies. Changes in communication patterns. You may notice an increase or a decrease in the frequency of calls or messages, or a lack of enthusiasm when communicating. You may even find that your loved one would like you to come over and do jobs that they're perfectly capable of doing, just to have you around so they don't feel lonely. Neglect of personal care is another sign of loneliness. It can lead to a lack of motivation to maintain personal hygiene or a clean living environment. That also includes keeping the kitchen and bathroom areas clean, taking care of their clothing, doing laundry, and that kind of thing. Changes in sleep patterns. Experiencing difficulty in falling asleep, sleeping too much, or other disturbances in sleep can be a sign of loneliness. And altered eating patterns. This could include loss of appetite or overeating, both which may affect their nutritional health. And this is a very common one, and that's why Meals on Wheels and other organizations that check in on the seniors, sometimes they'll just sit and have a meal with them or just socialize a little bit before they leave. Expressions of sadness or despair. Seniors may talk more about feelings of worthlessness or lack of purpose in life. Increased complaints of physical symptoms. Often, feelings of loneliness can manifest as physical complaints such as increased pain, headaches, or fatigue without a clear medical cause. There are also mental health issues. Symptoms of depression, anxiety, or mood swings can be indicative of loneliness. Now, there are resources and organizations to combat loneliness. Several organizations and resources that are dedicated to helping seniors combat loneliness through various programs and initiatives are the AARP Foundation's Connect to Effect. This platform offers tools to assess loneliness and find resources to help build social connections. Of course, the good old standby Meals on Wheels America. Known for providing nutritious meals to seniors across the country, Meals on Wheels also plays a crucial role in reducing social isolation by providing regular contact and wellness checks. There are also senior centers and local community groups that your loved one could join. Many communities have senior centers offering activities that encourage social interaction, such as classes, outings, and group meals. Check your local listings for the centers near you. And if health permits, joining a fitness program like Silver Sneakers can offer both physical and social benefits, providing classes and activities designed specifically for seniors. Now, I think there is some Medicare plans that will cover programs such as Silver Sneakers. Check with your loved one's insurance plan to see if that is a possibility. There are also virtual connections. One of them is Senior Planet, especially if your loved one lives rurally or does not have access to the other programs that we spoke about above. Senior Planet helps seniors use technology to help stay connected with others through free online classes that cover everything from how to use social media to online fitness classes. Now, the National Institution on Aging is a wonderful site, and they have resources and tips for older adults to find social support systems and ways to engage with their community. A couple of other activities that I've seen seniors enjoy was volunteering at local animal shelters. Both benefit the animals and person that is volunteering. And taking a class at a local recreation department or teaching a class. The seniors are a wealth of information, and their expertise is something we don't want to lose into future generations. And they can also join a senior group with same interests. If health permits, hiking, bird watching, art, singing classes are out there. All you have to do is help your loved one find these to connect. Now, tips for individuals and caregivers to help your senior would be the regular check-ins. It's extremely important. Also, encourage your loved one to participate in local events and activities. This will help foster that sense of community and belonging. And teach your loved one how to use digital tools. They're getting lost in this wave of technology. Addressing loneliness and connecting with your loved one is crucial for improving their quality of life. So be sure to take that time out and help your loved one find activities that enrich their life. If you have a caregiving question or concern, please submit your questions by leaving a comment below or fill out our form at www.caringvillage.com/questions. I look forward to hearing from you. Until next week.